If they cut our Medicaid, we would lose every hospital in our rural area, and then none of us would have health care. Not just the people on Medicaid, the people who have private insurance and Medicare. I'm a pharmacist. We took an oath to take care of people. We didn't say, no, only the rich ones.
Hello everyone, welcome back to my YouTube channel, and today we're going to talk about how cuts to Medicare and Medicaid are directly affecting people's lives across the US. From rural hospitals struggling to stay open, to Planned Parenthood losing funding, and domestic violence shelters being forced to close. It is really heartbreaking and could impact millions of people. And today I'll be sharing some of my views and honest thoughts, and as well as from the other people's point of view to this issue in today's video. And now let's get started.
It's September 12th, and if anyone was wondering, Medicaid no longer covers Planned Parenthood services as of today. Thank you to the federal government and their big, beautiful bill. So if you are one of the 1 million people that was using Planned Parenthood for things like STD, STI screenings and birth control, there's that horrible update. I know that Planned Parenthood nationally is still suing and taking the federal government to the courts based on this. But as of today, Friday, September 12th, Medicaid will no longer cover services. The Planned Parenthood closest to me in North Carolina posted on Instagram that they are still welcoming anyone to walk in the Planned Parenthood doors. And if you are a Medicaid recipient, they will walk you through what your options are. In the meantime, I'm going to be looking around and seeing what free services are available in the state of North Carolina to post them here to act as a resource for those who are using Planned Parenthood and or Medicaid recipients. And if you know of any, please comment them below.
Every hospital you go to in these cold counties will tell you 70% of their money comes from Medicare and Medicaid. So if that goes, we're hurt. These hospitals won't stay if they can't get that money. The big beautiful bill, it's going to shut healthcare down as we know it in these rural areas.
So you were telling me that people are unaware, they're unaware that the whole reason why hospitals are not allowed to turn you away in an emergency situation, regardless of your ability to pay, is because of the Emergency Medical Treatment and Labor Act, which states that hospitals who receive Medicare funding are not allowed to turn you away. And they are proposing to cut back on Medicare and Medicaid. Talk to a caseworker. There are no ineligible people who are receiving it. The only people who are receiving it are eligible because there is a vetting process. All these people that they say are illegally getting it, it's not happening. The point is to start the process to get rid of it entirely. And if we get rid of the only guaranteed payment for medical care in this country, and we leave it all to our pockets with no support, guess what's going to happen to you? You are going to lose out on care because hospitals are going to close who depend on that funding. We don't have enough money to pay the bills that they decided were fair, which I'm sorry, I just had a life-saving surgery and I owe $3,000. If I don't pay $55 fucking dollars that I don't have to my primary care physician, they can decide to no longer treat me, and they will. And I've got to start all over again somewhere else. You all think that you're safe because, it's been that way because we fought to get it that way, and they're reversing it. You all have been so fucking pampered that you don't understand what we had to fight for to get you. Oh, but POP, everyone dies. Bitch, apparently not fucking politicians.
So I just lost my job. If it looks like I've been crying, it's because I have been. I worked as a domestic violence advocate at a shelter here in Arkansas. And we found out last night that only 6 DV shelters in the entire state received federal funding, and we were not one of them. So I just got back from a meeting where we learned that our entire staff is getting laid off. And there are 25 other shelters across the state having the exact same meeting, having to let all of their staff go. This means that there will be hundreds of domestic violence advocates across the state, if not thousands across the country, because I doubt this is only happening in Arkansas, who will officially be unemployed as of October 1st, which, ironically, is the first day of Domestic Violence Awareness Month. Not only am I personally devastated to be losing my job and my amazing friends that I work with, but this is going to be absolutely catastrophic for victims of domestic violence across the country. I am not being dramatic when I say that people will lose their lives because of this decision, predominantly women and children. Like, we've known this was a possibility all year. Like, the state knew. We have been begging our state legislators for help. We've been begging the governor, our coalition. We've been begging our federal congresspeople. It's like, it's not like nobody knew this was something that could happen, and they just let it. They didn't do anything. I don't know what's going to happen with the shelter. Our director and our manager are going to see how long they can keep the lights on and just run it with the two of them as long as they possibly can. I don't know, y'all. Go register to vote. Go support your local domestic violence shelter, because guarantee they need it right now. And if anyone knows anyone hiring who wants a girl who's smart and pretty and works hard and knows a lot about domestic violence, send them my way.
My medication, it runs $20,000 a month without insurance. I make $800 a month. Oh, that will kill me. That would kill my friends. That would kill millions of people in this country if they lose their health care.
We're in California's District 22, a rural community in the state's Central Valley. This district voted for Trump for the first time in 2024, but now his policies threaten one of the benefits people here rely on the most. Do you know anyone personally who voted for President Trump but depends on benefits like Medicaid?
Oh yeah, I know a lot of people.
One resident who would be impacted by Medicaid cuts is 64-year-old Irma Arredondo, who voted for Trump in 2024. Irma has several chronic health issues, including type 1 diabetes. She's also a full-time caregiver for her daughter, who has cerebral palsy, and her sister, who has Turner syndrome.
The medicine that my daughter takes for seizures, I won't be able to afford it. So we feel hopeless if those cuts come, what we're going to do.
Irma was a farm worker for more than a decade. She believes that some of her and her children's health issues can be linked to the pesticides she was exposed to while working in the fields.
Look at me right now. Look at me, how many sicknesses that I have. We got all in the fields. Where else? I feel like these tapping us in the back, But why? Why when we put food on their tables? Trump promised a lot of things. I thought it will be more family values and those programs that they were really need here.
One of those promises was to protect Medicaid, which 67% of people in this district rely on. It's the largest percentage of any district in the entire country.
Did you guarantee that Medicare and Medicaid will not be touched?
Yeah, I mean, I have said it so many times, we're not going to touch it.
The yeas are 218, the nays are 214. The motion is adopted.
This bill represents the largest cut to Medicaid in American history. It will devastate vulnerable populations.
The largest tax break go to the wealthiest individuals. Are those your values?
No, that's not right.
Irma isn't the only one in District 22 who feels betrayed by the administration's plan to gut Medicaid.
The only people that are hurting are those poor people that really need the stuff. Elon Musk doesn't need it, Trump doesn't need it, and billionaires don't need it.
They're making out big time with this, but they're hurting people in the process.
If we could go back to November, who would you vote for now, seeing what you see?
For either one.
You just wouldn't have voted.
Not neither.
We've just seen a clear picture. Cutting Medicare and Medicaid isn't just about policing or budget. It's a matter of life and death for millions of people. In some rural areas, 67% of residents rely on Medicare, while millions more depend on Medicaid for basic healthcare service. If these programs are cut, people could lose access to hospitals, dental care, and in emergency situations, even their lives. And what's striking is that these decisions benefit the wealthy and large corporations, while the burden falls on ordinary people, those who have worked their whole life to earn a good living standard, earn a good care for their families. So here's the question of us today: who should healthcare policy really serve, the rich or the everyday community? I want to hear from you. Do you think that cutting Medicare or Medicaid is a major mistake ethically and socially? Or do you think there is a way to balance saving government money while still protecting people's healthcare rights? You can comment down below and share your thoughts. I really want to create a serious, open discussion with diverse opinions from everyone. And that is the end of our video today. Please don't forget to like, subscribe, and hit the bell button down below so you don't miss the future videos. And it's time to say goodbye. Thank you so much for watching.
Blaze surprise. Blaze surprise. Blaze surprise. Blaze surprise. Blaze surprise.